Hi, we are the thiazolidinedione sisters. My name is pioglitazone and this is my sister,
Rosiglitazone.
and we're here to tell you more about ourselves. So I am pioglitazone and that's for my generic name. And for my brand name, it's Actos. And for my chemical name, it's 1,3-thiazolidine and 2,4-dione.
Hi, I am Rosiglitazone and this is my chemical name. In pharmacies, I am also known as Avandia. For our drug classifications, therapeutically we are known as antidiabetics, while for our pharmacologic classification, we belong under the class of thiazolidinediones. We belong under the pregnancy category C.
For our mechanism of action, we are a class of medicines that lower blood glucose levels. So we bind to a nuclear transcription receptor called the peroxisome proliferator activated receptor gamma, or the PPAR gamma, in fat cells to promote the maturation of fat cells. And then we deposit the fat into the peripheral tissues. So us binding to the PPAR gamma also increases the adiponectin and lutein-4 expression. Adiponectin, along with the decreased levels of circulating fat concentrations with thiazolidinediones, lower glucose levels by decreasing a type 2 diabetic patient's resistance to insulin. So increased lutein-4 expression also increases glucose uptake in the muscles and adipose tissues. For my pharmacokinetics, in absorption, following oral administration, peak serum concentrations are observed within 2 hours with a mean absolute bioavailability of 83%. I am almost entirely less than 99% bound to plasma proteins, and my apparent volume of distribution of a single dose is 0.6 liters per kilogram body weight. I am extensively metabolized by hydroxylation and oxidation in the liver, and I am eliminated via urine with a half-life and my metabolites that ranges from 3 to 7 hours and 16 to 24 hours respectively.
For my pharmacokinetics, during absorption, my peak plasma concentration is reached about 1 hour after dosing. My bioavailability is 99%. During distribution, I am 99.8% bound to plasma proteins, primarily in albumin. During metabolism, I am extensively metabolized in the liver to inactive metabolites by N-demethylation, hydroxylation, and conjugation with sulfate and glucuronic acid. For my excretion, I am eliminated via the urine and feces, and my half-life is 3 to 4 hours. For our indications, we are used for patients with type 2 diabetes, helping in glycemic control and insulin resistance. We may be taken alone, or we may also be taken with sulfonylurea, metformin, or insulin. We should also be an adjunct to diet and exercise to improve glycemic control. We may also be used for patients with polycystic ovarian syndrome, or also known as PCOS, helping in improving endothelial function and improve ovulation. For my other half, pioglitazone, she is specifically used for patients with non-alcoholic steatohepatitis, or also known as NASH. She helps reduce hepatic fat and improve liver fibrosis.
Our contraindications include heart failure, moderate to severe hepatic impairment, bladder cancer, teratogenic effects in pregnant women, high risk of fractures, and hypersensitivity.
Now for our side and adverse effects. In the central nervous system, we may cause headache or fatigue. For the eyes, ears, nose, and throat, we may cause sinusitis, pharyngitis, macular edema, or blurred vision. In the cardiovascular system, we may cause edema, congestive heart failure, myocardial infarction, or angina. In the respiratory system, we may cause upper respiratory infection, or also known as URI. In the musculoskeletal system, we may cause back pain, fractures, or myalgia. In the gastrointestinal system, we may cause diarrhea. In the hematological system, we may cause anemia. In the reproductive system, we may cause increased ovulation with teratogenic effects. For other side effects, we may cause tooth decay, accidental injury, or weight gain.
So for the nursing responsibilities, the nurse has a lot to remember before drug administration. So here is a list of nursing responsibilities. Prior to drug administration, the nurse must obtain and document a thorough history, vital signs, blood glucose levels, potential complications, and drug interactions. Assess the patient's ability to consume food. Assess for nausea or vomiting. Hypoglycemia may be a problem if antidiabetic agents are given and the patient does not eat. If a patient is NPO for a test or procedure, consult physician to clarify orders for antidiabetic drug therapy. Keep in mind that overall concerns for any diabetic patient increase when the patient is under stress, has an infection, has an illness or trauma, or is pregnant. Thorough patient education is essential regarding disease process, diet and exercise recommendations, self-administration of insulin or oral agents, and potential complications. During drug administration, patients should have liver function test or LFT evaluation. Monitor for clinical symptoms of hepatic injury such as jaundice or dark urine. Monitor patient's body weight as a means of detecting possible fluid overload. Signs and symptoms of fluid overload or heart failure such as rapid weight gain, peripheral edema, dyspnea, S3 heart sounds, or decreased ejection fraction requires close monitoring. Assess for signs of hypoglycemia. If hypoglycemia occurs, give glucagon, have the patient eat small snacks such as crackers, and monitor for blood glucose levels.
After administration, the nurse should report for any fever, sore throat, unusual bleeding and bruising, rash, dark urine, or any hypo and hyperglycemic reactions. She should also monitor the response carefully. Blood glucose monitoring is the most effective way to evaluate the dose. The nurse should also provide comfort measures to help the patient cope with the drug effects. The nurse should also monitor the nutritional status of the patient to provide nutritional consultation if needed. Lastly, the nurse should provide patient education about the drug's effects and its warning signs to report to enhance patients' knowledge and to promote compliance.
So I guess that's all about us. Thank you for listening, and we hope that you have gathered as much information about us thiazolidinediones.